work is to go to communities, to churches, to mosques, workplaces, to talk about this. I know cancer is a very sensitive topic that no one wants to talk about. I don't know, in your communities, do you talk about cancer? No one. Why is that? I just want to know why. Yeah. Yeah. So what comes to your mind when you think about cancer? Like death? Yeah. What else? Sorry, air loss. Yeah. What else? Sorry? Weakness. What else? Financial instability. Yeah. What else? Yeah. I know all those are negative, isn't it? Is there anything positive about cancer? No? Nothing. Okay. Yeah, so sometimes I know when we think about cancer, and when we think about other diseases like diabetes, we talk about them, without fear. But when it comes to cancer, no one wants to talk about. And the more we shy talking about it, is the more we don't understand our bodies. We don't know what signs and symptoms to look for. We not able to support others. We don't know when and where to go, for screening, all those. And if we don't understand facts about cancer, then we shy away from speaking about it because, we feel like, oh, it's a death sentence, When you get cancer, that's it, that kind of a thing. So we want to make this as a subject that everybody can talk about it without fear. And once we know facts about cancer, then we are able to know when do we need to see the doctor, what signs and symptoms to look for, when and where to go for screening, how can we do to reduce the risk of cancer. So all this we're gonna talk about today. And I'm gonna talk about the 3 NHS cancer screening, and my colleague here, Jide, is gonna talk about prostate, specifically for men. But I know, ladies, you need to have this information as well because it's important. You have men in your life, so it's important that everybody knows about this. Okay, so before I talk about the 3 cancer screening programs, I want to know how many of you knows the 3 cancer screening programs that are here, provided by the NHS? No? No one, okay. Do we know signs and symptoms to look for? You only know for the breast, okay. What else? Anybody else who knows the signs and symptoms to look for? No? Okay. So if you are invited for screening today, do you want to go? Yes, okay, okay. So I'm gonna check about this after this session. So those 3 questions after the session, we're gonna see how will it improve after the session today. So we as Answer Cancer, we increase the uptake of cancer screening because we saw that there are communities that are uptake is low, and we work with voluntary organizations to raise awareness around screening and possible symptoms and causes of cancer. So we work with 4 organizations, which are Salvo CVS, BHA for Equality, so I'm based in BHA, in Jide as well. And we work with voluntary sector organization, Northwest, and we work with Unique Improvement as well to raise awareness around this. So with Salford CVS, they give grants, and then with the BHA, we are the community engagement workers. And then voluntary sector Northwest, they do recruit champions. So if you're interested in being a champion to raise awareness around cancer and cancer screening, they provide training for you to have that confidence in speaking about, cancer to your friends, to your community, to your church, And then we have the unique improvement that they do the evaluation. So, we evaluate our sessions as well. Okay. So, and then we have as well, like we work with employers to sign up the Be Seen, Get Screened initiative, where they allow the employees to go for their screening when they are due, and they still, they are given time out to go. Because sometimes people find it difficult to go for their screening, they don't have time. So they are given a time out to go for their screening when they are due. Okay? So we've talked about cancer, and do we know how cancer starts in our bodies? No. So I'm gonna explain. Okay. So our bodies are made up of cells, and cells get instructions to replicate and divide. So when something goes wrong, okay, so cells can replicate and divide uncontrollably, and these extra cells can form lumps that are called tumors, which can be harmful. And the doctors can check if it's cancer. So some lumps, we could develop lumps, but they might not be cancer. But the doctors will check if they are cancer. So sometimes we can't control that because, the cells are replicating, and if there's any disruption in the process, it could start growing abnormally, and it could result into tumors. And it could be harmful. So the doctors need to check if they are cancer or not. So you could see how it changes, how it starts to behave abnormally, from normal to abnormal. And if it starts to be abnormal, it forms like growths, which are like tumors. Can cancer happen to anyone? Yes, so no one is immune to cancer. If anybody can get cancer at their lifetime. So here in the UK, 1 in 2 people will get cancer in their lifetime. So that means it's half of the population, isn't it? So we need to do something about. Yes. So we know our bodies very well. We know what is normal, what is not normal, and we know a symptom that has gone for a long time, doesn't go away. Please speak to your doctor. Okay, so it could be something that has gone for like 3 weeks and it doesn't go away. Please speak to your doctor to get checked to rule out it's nothing serious. 90% of cancers happen to people over the age of 50. So as we grow old, our risk increases, okay? So, and there's nothing we could do about our age. We are aging, all of us, but, we can't say we want to still remain young. So we can't control that. We can't control our genetics as well, So if you have a family history of cancer, especially breast cancer, prostate, it's important to check yourself and speak to your doctor as soon as possible, so that they can, check your risk of getting cancer. So they might invite you for screening early before you are even due for screening. So do you know the most common cancers in the UK? Yeah, prostate for men, breast cancer. Breast cancer, men can get breast cancer as well. Yes. So we're going to talk about that. Yeah, that's right. Lung cancer and bowel cancer. So those are the 4 most common cancers in the UK. We are not saying the others are not there or they are not common. They are there, but the most common ones are these 4. So prostate affects mostly men, and he's going to talk about more on that. Breast, mostly women, but it's very rare with the men. Lung cancer affects most people who have been smoking before, but we are not saying that if you've not been smoking, you will not get lung cancer. Bowel affects both men and women. Okay. Can cancer be prevented? Yes, yes, we could do something to reduce the risk of getting cancer. We're going to talk about that quickly. Yes, it can be prevented. So, cancer cases are preventable according to the statistics 2015, and almost 1 in 3 cancers can be prevented. What can we do to reduce the risk of getting cancer? Yeah, regular medical checkup is important. So whenever you have a symptom that has gone for a long time, you feel like, no, this is not right, please speak to your doctor, to get checked. Okay. What else can we do to reduce the risk? Sorry? Screening, yeah, attending screening is important, yeah. Health lifestyle, yeah. Vaccination, yeah, like for example, HPV vaccination to prevent cervical cancer. We're going to talk about that briefly. Anything else? Food, yeah, diet is important. Whatever is in your plate, please be, be aware of what you are eating. So what we are saying here is that smoking is one of the causes that increases the risk of getting cancer, and it's important to for people to stop smoking, because as you smoke it, you're increasing your risk of getting cancer, especially lung cancer. And eating healthy, as we said, so eat more of fiber, more of vegetables, less of red and processed meat, more grains, whole wheat, whole grains, brown bread, brown rice, brown everything, brown pasta, and all those. Keeping a healthy weight, it's important to check your weight, make sure that you keep the healthy weight. It helps you also with other diseases, from preventing from other diseases like diabetes, and all the other cardiovascular diseases, So when you keep a healthy weight, it helps you with any other, prevent more other diseases as well. So keep physically fit. So make sure your heart beats, at least, when we say take a walk, it doesn't mean that you go slowly, but you make sure that your heart beats, as it needs to be. So it could be walking, it could be doing exercise at home, something that makes your heart, beating. And then reduce alcohol intake, be sun safe and avoid sunbeds, especially with the skin cancer. And take part in screening, which is important, because screening is for healthy population. So they screen people even if they don't have symptoms. So some people, they can find cancer in your bodies when you go for your screening, which you didn't know that you have cancer in your body. Okay. So we're going to talk about screening quickly. So things that we can't control, age and genetics, that we can't control, because we are all aging, and we can't say we can avoid our genetics, If we have a family history of cancer, we can't say, there's a likely possibility that you might get cancer or you might not. So it's important to know your risk, to know your genetics, to know your family history, so that you can, check yourself in time and talk to your doctor to get checked. Okay? So do you think survival is more now than 40 years ago? Why is that? Yes, so more has been put into research and treatment, which has improved, and cancer can be caught early at an early stage, where treatment could be successful, which is good. And, there's more that has been done. So different treatment, more research that has been put into this, and there are more survival now than 40 years ago. So people can survive more even after diagnosis. We're going to see about the statistics now. So for example, when we talk about breast cancer, the survival at stage 1, so we want to catch cancer at an early stage where treatment is more successful. So For example, with breast cancer, according to the statistic 2016 and 2020, most women at stage 1 will survive. So 100% will survive their cancer 5 years or more after diagnosis, which is good. At stage 2, it's 90%. At stage 3, 70, and at stage 4, 25. So you could see the early cancer is got at an early stage. There's a likely possibility that it could be treated and the treatment could be successful, which is good. Let's see about bowel. For the bowel, at stage 1, it's 90%. At stage 2, 85. At stage 3, it's 65. And at stage 4, it's 10. So you could see, how the survival changes according to the stages. And then for the cervical, at 95, at stage 1, it's 95. At stage 2, 70. At stage 3, 40. And at stage 4, 15. So you could see, the early cancer is got at an early stage. There's a likely possibility that people could survive 5 years and more after the diagnosis. So what is cancer screening? Let's go to cancer screening now. What is cancer screening? Yeah. Did you say something there? That's right, yeah. So you're both right. So it's a test to check if you have cancer, even if you don't have any symptoms, okay? So we're gonna see that. And do you know how many cancer screening we have? Sorry, before I go there. How many cancer screening programs we have that NHS provides here? Smear and cervical screening and breast screening, okay? You're right. One more. Yeah, so it's the smear, which is cervical cancer screening and breast screening, and one more. Prostate. You almost there. Yeah, so we're going to talk about prostate, what they do for prostate. They don't provide screening at the moment, but they do blood tests, but it's going to talk about that. I'm not going to touch that. So bowel is the third one. So it's breast, cervical, and bowel. So those 3 screening are provided for free by the NHS if you are registered with the GP. So you are eligible if you are registered with the GP. So make sure you register with the GP. I know some people might have difficulty because of their immigration status or anything, but it's important to get registered so that you don't miss your screening, okay? So screening, cancer screening is a screening to look for early signs of cancer in people without symptoms, and it can help find signs of cancer before they turn into cancer. So, and they screen healthy population. So they don't wait for you to have symptoms, but they screen you before you get the symptoms. So it can find signs of cancer early when treatment is more likely to be successful. And screening is for people with no symptoms. And if you have symptoms, don't wait for screening. Go to your GP as soon as possible. So between your screening, it's important to speak to your doctor if you notice any changes, which we're going to talk quickly about it, the changes that you need to look for. So we've mentioned the 3 NHS screening programs: breast, bowel, and cervical. So when women attend breast screening, so 1 life from breast cancer for every 200 women it saves 1 life from every 200 women screened. With the bowel, it reduces your risk of dying from bowel cancer by at least 25%, which is good. And for cervical, if everyone attended screening regularly, 83 of cervical cancer cases could be prevented, which is good. So we want to save more lives from cancer. So how does it happen with the screening? How many of you have gone to breast screening? So we're going to talk about the 3 cancers. Have you had your breast screening before? Not yet. Okay. You've gone, not in the UK, but in Nigeria. Okay. Oh, that's nice. Yeah. Some countries you have to pay for it, but in the UK it's free. Yeah. Have you gone to one, Mom? I think you mentioned you've gone to mammogram. Yeah. Do you want to share your experience? No. It's not easy. Yeah. 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 It's gone. Yeah. Yeah. So some women find it a bit uncomfortable, but because they want to check the inside of your breast, to check if you have cancer. So because we have a large tissue, sometimes they want to check the inside, so they have to clamp your breast with the breast plates, and that's why it's a bit uncomfortable. But it's only once in every 3 years, and you wait for another one. Yeah. So normally, women, trans, and non-binary aged between 50 to 70 are eligible every 3 years. So every 3 years, you get a letter at home to say you're due for your breast screening, and it's up to you to make an appointment. So don't put it on the side, because some women would just don't have time to go and do this. I'm fine, I'm okay, why should I go? I don't want to know, But it's important to know, because sometimes we might have cancer in our bodies, which we didn't know it's there. So it's important to know. As we said, when cancer is found early at an early stage, then there is a likely possibility that the treatment will be successful. Then when it's found at stage 4, because then you will go through the treatment process. So it might be so difficult time. But at an early stage, there might be, successful procedures and all those. And then women over 70, if you're over 70, you can still request for one if you still need to get screened as well. You want to say something? Yeah. Yeah. For the screening. So did you mean if you are under 50? So if you have symptoms under 50s, if you have symptoms and you feel like you need to get checked, please speak to your doctor, and they can refer you to breast screening if you need one. Yeah, depending on your symptoms, then they will refer you to your screening. Yeah. No, for this one, they will invite you even if you don't have symptoms. Yeah, so they will screen you even if you don't have symptoms. So at age 50, they will invite you to go for screening even if you don't have any symptoms. Okay? So they will check if you have cancer even without symptoms. Some people, they found cancer in their bodies. When they attended screening, they found they have cancer, which they didn't know. They didn't have anything in their bodies, but they found cancer. So it's important to attend even if you feel like you're fine. Okay? Sorry. Yeah. Is that answered though? Yeah. Yes. Unless you have symptoms, then you can speak to your doctor, and if they would need, they will refer you to screening, even at below. Yeah. So they will assess the situation. If they will understand also your worries as well. So you might be better to speak to your doctor and speak about what are you worried about and all those. Then they will see what they would need to do for you. Yeah. Otherwise, if you have symptoms, especially also if you have a family history of breast cancer, your sister, your mother, your auntie has had breast cancer before, please speak to your doctor, because you might get screened early, or they might assess your risk if you have symptoms, So if you have symptoms and you feel like, oh, you had a family history and you want to get checked, please speak to your doctor, because they have like a family history clinic where they assess your risk of getting breast cancer. So usually it's performed in a mobile van or in hospital. So usually there is a mobile van that comes to a strategic place where, people are invited, women are invited when they are due within a certain region. It could be in Asda, Tesco, wherever, which is convenient, or an health center. Then they will invite you there to go for your screening. And as we said, men can get breast cancer as well. So men, it's very rare, but they can get breast cancer. I've worked with men survivors of breast cancer, and they were sharing their stories. They didn't know that it was cancer until they were diagnosed of breast cancer. So it's important to check the symptoms, and the symptoms that we're going to talk about. So that's the unit that I'm talking about, the breast screening unit that is mobile, that women are invited when they are due within a certain region. And you can see the mammogram machine that she was mentioning. They want to check the inside of your breast, so they will put the plates together and check your breast, both breasts. So they will do like that, and then like that, and then they go to this other breast as well to check if you have cancer. Okay. So what are the signs and symptoms to look for in your breast if you're not due for your screening? We say know your lemons. That's how we can relate so well, when you say know your lemons, So you could see changes in your breasts, any changes. It could be a discharge coming out. You're not breastfeeding and there is a fluid coming out. Please speak to your doctor as soon as possible. Any lumps are found here in your neck area here. Yeah? Any lumps around your neck area. So keep checking any lumps around your neck area here, under your armpits as well. So any lumps that are really hard to touch, or any lumps around your breast area could be a sign of anything. It could be, a first sign of breast cancer. So please speak to your doctor to check and to rule out it's nothing serious. Any dimpling in your breast, so we have dimples. So any dimpling around your breast, is important to check and speak to your doctor. Any inverted nipple, so one nipple could be inverted. So if you notice any changes, if one nipple is inverted, please speak to your doctor. Any changes in size, so your breast sizes, it could be, one was bigger than the other before, that was normal for you, and then suddenly it changes, then you notice that, oh no, this is not normal, speak to your doctor. Any rush, in your, any itchiness, or changes in skin color around your breast area, please speak to your doctor as well. Any changes in skin color, any dimpling, any inverted nipple, any lumps, any growing vein, any changes in sizes as well, any thick mass, you could see any changes in your breast. You could see what is normal, what is not normal, and you understand your body very well. Speak to your doctor as soon as possible. So what we recommend is that we say, check your breasts once a month. It's important. It's advisable to check once a month. So you could choose a date, to check. So go to the mirror when you're showering, check for any changes. Sometimes, under our breasts, so if we put our hands up like that, we are able to check this part of your breast. If we put our hands like that as well, we are able to see as well, how the sizes and, the shape looks like. So, and then when you're looking for lumps, it's important to lie down and to use the 3 parts of your palm, yeah, like that. So if you're moving in a circular movement, make sure you cover all your breasts to check for any lumps. Lumps are really hard to touch, and it's so hard to find. So I have a breast model here, but I don't want to do you want me to pass it around, or is it okay not to? Or we could do another session with the women only. So where people can find, and it's so hard to find those lumps, you know. So I always take it to my sessions and show it to women, and they find it so difficult to find those lumps, you know. So, and that is how it's so difficult. So you need to do it gently in a way that you make sure that you are finding something hidden inside, you know. So make sure you go around and, you know, check for any lumps. They are really hard to touch, and they might be painless. Some people found lumps that were really painless. They didn't have any pain, but they found lumps. So go around, make sure you cover all your breasts, you know, and then check your neck as well, this area. So if there are any lumps here, that's, you know, could mean a sign of something, and then under your armpits as well, okay? So changes in size, changes in color, tingling, inverted nipple, any discharge coming out, any lumps, all these things that you need to check once a month. That's the recommendation, okay? So we say touch, look, and speak to your doctor if you notice any changes. Then we go to bowel. Bowel affects both men and women. And you could see it affects, this is a small bowel, and this is a large bowel, and this is rectum. So bowel cancer can be found anywhere in the large bowel, including the rectum as well. So bowel cancer is one of the most common types of cancer in the UK. And bowel cancer screening can pick up bowel cancer early, which may mean it's easier to treat, okay? So you could see where it can be found in our bodies. So how does it work? So men and women at the age of 50 to 74 are sent a test kit to complete every 2 years. So every 2 years, they send you a test kit. I have it here, sample. So this one here. So at the age of 50, they will send you this test kit where I'll show you how it looks like. So that is the test kit where they send you home, and they want you to take a stool sample. So that is how you would need to take a stool sample, just a tiny bit of the stool, and you send it through post. So it's a free post where you send it and you wait for your results. So it's that simple. So at the age of 50 to 74, you are sent this at home to do a stool sample and send it through post, and you wait for your results, okay? So, so it's only one sample that is needed, and the test picks up blood in the poo, which you can't see it in your naked eye. So that is the reason why they take the stool sample, is they want to see any traces of blood in your stool, which you can't see it in your naked eye. And when you are over 74, you can still request for one if you still need one, okay? So, yeah, okay. So any signs and symptoms that you know that we need to look for if you are not due for your screening? So any blood in your stool is one of them. Any tummy pain, any unexplained weight loss, you know, any constant urge to go to the toilet, any changes in your poo, having to poo more or less, that could mean something. So speak to your doctor as soon as possible to get checked, okay? And then we go to cervical screening. So cervical screening, I know most women have gone for their smears, isn't it? Anybody who has missed their smear? You have missed one. Yeah, so you can always ring to your GP to say that you want to get your smear, and they will book you an appointment. Yeah, okay. So it's always done at the GP, and it's between the age of 25 to to 64. So it used to be 25 to 49 every 3 years, but now they've changed from 25 to 64 every 5 years. So this year they've changed it. So it's now 25 to 64 every 5 years. They will invite you for your smear, okay? So it's usually performed at the GP. And if you get that letter, please speak to your doctor. Call your GP to get the appointment, okay? So because of time, I will ask you a question. So how many NHS screening programs do we have? 3. Which one and which one? Oh, you are good students. Well done. Bowel, cervical, and breast screening. Well done. So if you are invited for screening today, would you want to go? Good. Do you know the signs and symptoms to look for? Yes. Thank you so much for your time. Thank you. I'll invite Jide to speak briefly about prostate. Thank you.
Hello, everyone. Hello, everybody. Oh, I thought the men were not in the room because I was concentrating so much. Okay. My name is Jide Macaulay, and as you heard in the introduction, I'm also one of the community leads on Answer Cancer. This is actually the second half of my presentation. The first half, I'm going to skip it because I think I can cover some of the things here. So we want to talk about men's things, and if there are younger people in the room, they need to go out. So everyone else can stay. Okay, so first of all is as Naomi has said, I'm going to actually pass something around the room, just to get you to look at it. So it's actually this item here. You see this one here? Okay. So Naomi, if you just pass it around the room, I will explain that later. Please make sure that it gets back to me. Just have a look at it. Okay. So most cancer risk, prostate cancer risk for men, obviously, is also to do with age as well. But some of the things that are so important is that if you have a family history of cancer, then you need to go and check early. I think a question that came from the floor is that if I don't have symptoms, can I still go for the routine? Yes, you can. Just tell me. The NHS want us to be present. They want us to come along and get all the information that we need. Now, the other thing that's also very, very important is you being aware of yourself. Self-awareness is so important. So our ethnicity matters as well. Okay, so black men have a higher risk of prostate cancer. Okay, so in the UK, is 1 in 8 men who likely to be diagnosed with cancer, but it's 2 out of 8 out of 4 men that is likely to, 2 out of 4 black men, sorry, are most likely to be diagnosed. So the bar goes up. Okay. So, and I think the other thing again is that we talk about genetics and weight and other factors as well. So what's prostate cancer, just to be clear? It's a small muscular gland like the size of a walnut, okay? Walnut is not that big, sorry. Size of a walnut, okay? That is the size of your prostate gland, okay? I'm going to show a few graphic pictures just to give you an illustration. So it's literally a mechanical switch between the urination and ejaculation, okay? So these are things that you need to know, okay? And of course, it also produces the semen as well. So here we go. This is actually my first image for you. So you can see where the bladder is. You can see where the urethra is, the penis and the testicles. Okay. So I'm going to show you another one that is much clearer. So here we go. If you look at this is actually the male reproductive system. I'm not going to go through everything. But of course, the bladder is what we're talking about today. So you can see where the rectum is and where the prostate is. So the prostate is literally where, you can see the seminal vesicle as well and the ejaculatory duct, okay? So basically what we're talking about, if you don't mind, is this bit here and the urethra, okay? That line that goes down there. So when there's an issue with the bladder, this is the area that is of great concern. So the prostate is here. So even though this is a picture, it's just the size of a walnut. It's just to make sure that you can see it clearly. Are we good so far? Okay, good. Yeah, thank you so much. Next slide. So now, when we talk about a normal and enlarged prostate, this is what we're looking at. So again, this is what the normal prostate looks like. So this is the inside. Just imagine this is your bladder, okay? The next thing is that when you go and urinate, okay, normally everything should flow out. When you feel the urge to urinate naturally, you should go and urinate and everything will be fine. But where it's becoming enlarged is when the prostate glands have got issues, okay? So it means that when you go and urinate, you don't urinate, everything doesn't come out at the same time. So you find yourself having to go a few minutes later or 30 minutes later, okay? So if you have an enlarged prostate, just imagine you need to go to, let's say you're going to Piccadilly Station, for example. So when you're on the bus, like halfway through your journey, you feel like you want to urinate, you might have to get off the bus, Yosemite, and find somewhere to urinate. That is sometimes how bad enlarged prostate could be. Let's do the next slide. Okay, so some of the questions that you might have is, what's going on with your body? The first thing is incomplete emptying. So when you urinate and, you don't go fully, that is a sign of prostate cancer. The frequency is also an issue. Intermittency is also an issue. The urgency, so if you feel that you need to go urgently as well, could be an issue. The weak stream of your urination is also an issue. And if you're straining as well, that's also another issue. Nocturia, if you're going too frequently or even at nighttime, okay, if it's really disturbing your life, then it's something you need to pay attention to. Is the next slide? Yeah. So what do we do next? Once you know about prostate cancer, what is the next thing to do? You ask your GP. Now, Naomi has talked about the 3 cancer screening on the NHS. The PSA is not on the NHS per se, but you can get your GP to do what is called prostate-specific antigen test, which is shortened to PSA. Now, you can demand for it, seriously speaking. I say go to your GP, the men in the house, go to the GP and be dramatic, okay? Seriously. Otherwise, if they ask you how painful is your pain from 0 to 10, my always say 10. Thank you. Someone said 11. I always say 10, honestly. Listen, don't discharge me right now. Okay, so but depending on the results, you might be recommended to do a number of things, okay? And there's a digital rectal examination to examine your prostate, okay? When they do the test, it's actually a blood test. They'll come back and tell you the results. Usually they're looking like a 0.4 something. Anything less than that is not prostate cancer. And the other thing with prostate cancer is also, symptoms also have non-cancerous symptoms can also, sorry, non-cancerous symptoms may not mean cancer, okay? So you can have all the symptoms that looks like is prostate cancer, but it's not. But if you're age 50 and over, please don't joke. We're no longer 20, 30-year-old. Our body is not the same. The body changes as well. So if you have an enlarged prostate, it's not necessarily cancer all the time. So don't scare yourself, okay? I was going to say something. Let me just say it now. I was excited when I was invited to come and talk here because I was here last week and we realized we came on the wrong day. I'm excited, and I think you should all give yourself a round of applause. Honestly, I'm very serious. I'm very serious. Pastor, can they do that round of applause like they mean it? Okay. So listen, honestly, the reason I'm saying this quickly is that rarely do you get to talk about health issues in the church. A lot of people are going to pray it away. It doesn't work like that. We need information. Okay, so thank you. So if there's a diagnosis of cancer, okay, there's a multi-parametric MRI. Okay, let's just say MRI to see why your prostate is enlarged. Okay, so they need to go through a number of things. Okay, there is a transperineal biopsy. Okay, it's literally an examination of the prostate glands. Okay, they will take some of the tissues and provide an examination for it, just to check what's going on. Now, let me say to you, the men in the house, okay, you know, they used to do an examination where the doctor will put a finger up your bum, okay? That has been ruled out now. They can just do the test, so don't worry, because that's one of the reasons that men don't go to get a check. So you don't have to worry. I mean, it is a possibility that it can be offered, but it is not mandatory, okay? So further active treatment could be radical prostatectomy, okay? A surgical procedure to remove the entire prostate gland along with some of the tissues around it. That's if prostate cancer is found. You understand me? The whole gland can be removed, you know, just to make sure that you have a healthy outcome. The other one is a high, I beg your pardon, just click on, oh goodness. Thank you. Right. So the other one is actually radiotherapy as well. If cancer is found in the prostate, they would do. You get just click to remind me tomorrow. Otherwise, we're going to be here forever. A course of radiotherapy will be prescribed for you. Someone that used a service, had prostate cancer December last year, and they went for treatment. They had like about 20 treatments, literally radiotherapy to blast it, and after 20 treatments, everything was fine. Everything was fine. Just like Naomi said, because I think that if you go to the next slide, I think I'm probably done. Right, yeah. You do not have to be a victim. Take control, act promptly, and have treatment and peace of mind. Let's see the next slide because I think I'm done. Okay. Before I go to any questions, one thing I'll say is that, honestly speaking, probably in my introduction, you had my name. I'm Jide. I'm Yoruba. I was raised in Nigeria, and our parents and grandparents will tell you not to touch yourself. You understand me? Especially our private areas. But, every morning, men, women, please check yourself. Not every morning, sorry. Most frequently, check yourself in the mirror. Anything unusual about your body is a health concern. You understand me? It's a health concern. Just get it checked out. And the other thing, again, is that I think I like this church because you can talk to each other, form peer support groups amongst the men to talk about issues that are really of concerning. Prostate cancer is killing a lot of black men in this country. And I think many of us are coming from Nigeria, from Uganda, from Malawi, from all over Africa. And then we get here, everything looks so strange. But it's so important that we have the right information. I've got some cards to give away, some information leaflets to give away so that you can read further later. Thank you so much. Any questions? And that also includes the ladies as well. You can ask questions about prostate cancer.
Or any question generally. I have a question though.
Okay, go ahead, Pastor.
So the question is the screening itself.
Yes.
For either the women or the men. Like X-ray, there is this concern that if you do it too frequently, there are concerns. So for example, if I follow somebody to the X-ray room, they tend to put something on you so that you are not exposed to that ray at that time. So I want to ask with screening, right, is there a concern that you do it too frequently or too often?
Actually, there's nothing as too frequently or too often. I think the medical team, when they assess you, will recommend the number of screening that you have, okay? And of course, with prostate cancer, like many of the other cancers as well, there's also recommended at age 50. The difference is that you don't get an invitation by NHS for prostate cancer. You have to go in. And that's where the reluctance comes in as well. But we have a program, Naomi mentioned it, where we encourage employers to give you time off. You understand me? And that time off is not going to be taken out of your annual leave. it's not going to be taken out of your normal sick leave. Do you understand me? You understand me? A lot of people are signing up to this. And if you're an employer in the house, we recommend that you give this time to your employees as well so that they can go and get checked as well. Yeah. So, yeah, go on.
In the case where you have done a pap smear and okay, we can see that there are like maybe cancerous cells, and you have to be exposed to like some radioactive elements. So I've heard of cases where you are exposed to those radioactive elements and it affects maybe your tubes, because it's like something that has to do with the cervix, right? So can you shed more light on that area? Thank you very much.
Oh, yeah. I don't think we are talking more about the treatment here, but we're talking about screening. Yeah. But then, yeah, so it's different, different cancers has different treatment, stages of treatment, and also there's also side effects of those treatments as well. So we can share that information later to you, particularly, or we send it to Sam to share around. So if you want to know more about that after treatment, side effects, and all those, yeah, we'll share that. Yeah.
Yeah, any kind of medical concerns you have is important to just get checked out. We always say that Professor Google and ChatGPT are your friends. They're not really, to be quite honest. I love IT and artificial intelligence. It's what you put in that you get out. But it's important that you find the doctors, to make sure that you get the right information. Right. Any other question before we close? None. Okay, put your hands together for yourselves again. Thank you.
Thank you. Can we put our hands together for our facilitators? Can I also invite the original pastor? Because me, I'm the fake. The pastors are the prerequisite for a group photograph with our facilitators. Where is our movie director? Cameraman.
I'm so sorry. I didn't pass this round.
Yes.
Okay, basically I pass it around. Did you guys all observe it? Right, okay. So from the tip here to the golden one, okay, that's when you go in for your screening that they can pick it under a microscope, right? You see that's the size. The red one is the one that you can feel. And if you can feel the red one, it's late stage. So we're asking you to check, go for your screening so they can find it. So if it's actually this tiny or this big, they can only find it under a microscope. If it gets to the red one, you understand me, it's really big. Okay, thank you.
So can we have the group photograph, please? Pastor Adele. Sir, can you, just for a second, can you join us? Pastor Mrs. Adejumot. Oh, yeah, who is taking the picture? Who is taking the picture? Okay. After this one, then every one of us, if you're interested, we can also join. Are we done? If anybody else interested in joining us for the picture, anybody, me, I'm interested. We don't go. I'm interested. Emma Bo. Thank you. Can we once again give our facilitators a big round of applause? Thank you very much. Thank you so much. God bless you. This will be the end. Okay. If you have been screened and you want to, we employ you to take a picture with this one. Pastor Mr. Dejumo, you have been